Hi everyone, I'm Dr. Somlina. I'm a final year radiology resident, MD radiology resident at NRS Medical College right now. And we have our examinations in December, and that's why things are quite busy these days with thesis completion and all those stuff. Hence, I could not afford enough time to edit the background. So this video is going to be in the natural background. I know it's not aesthetic, but bear with me. So I wanted to share my journey of Neet PG, especially because I was not a very good student during my UG days. During school life, though, everyone were good students only. Though everyone who is in the medical field, they were toppers, or if not the first three, at least in the first 10, they used to come. Anyone who is in the medical field, but after you enter into your MBBS, suddenly for some reason you're not the best student anymore. That happens with majority of the students, and that happened with me also. Partly because taking MBBS was not my primary motive. In fact, I had never thought of what I will take up as a profession during my 11th and 12th. It was when I took a year gap after my 12th when I decided and came to a conclusion that I will take up medical because my parents wanted it. Simple reason, I took up medical because my parents wanted it. Hence, from first year, second year, all those subjects where we did not have any proper clinical correlations, we did not have any wards along with the subjects. So in those years, I was very reluctant to study. I did not like studying medical at all, especially anatomy, because I have to take up a dead skeleton and then rectify all the bony markings, the muscle attachment, and I could not find out the reason why I'm doing it, because those days the examinations are not so much clinical based in the MBBS. In the professional examinations, there were no clinical based questions as such. Now I think I have heard there are certain changes in the curriculum by which you have to give clinical oriented questions, but that time it was not the case. Hence I felt very bored because I could not find a cause. Then from part 1 onwards, when we got ENT, then and then in my final year subjects also, because I could see the patient, I could see that if I'm studying the anatomy of the ear, this and this disease I can diagnose. When I'm seeing that this anatomy that I'm studying, the physiology that I'm studying is actually of some use, then I started gaining my interest. So because of this reason, my performance during my MBBS days were very, below average, I must say. So getting selected for Neet PG examinations in the year immediately after my internship was never a plan for me, because I thought of enjoying my internship. Enjoying in what way? I wanted to work as much as I could so that I can learn some clinical skills. At the same time, I did not get chance to go out a lot to restaurants or movies during my UG days because I did not get a lot of pocket money. My pocket money was around 1000 in a month, and in a city like Kolkata, 1000 in a month becomes less if I'm going to go to restaurants or to movie theaters. Otherwise 1000 is sufficient for living a normal simple life, but if I want to enjoy, have some entertainment, recreation, then 1000 becomes less. Hence during my UG days, because I did not go to so many restaurants, I had not explored the city as such, I took it up on myself to do all those things during internship. So my internship routine was basically go to work, come back tired, sleep for hours, then eat, and then go restaurant hopping, movie theater hopping, and that was all about it. Towards the end of my internship, I realized that this Neet PG thing is actually very important. People take it very seriously, because I saw so many of my batchmates, they had already started studying. They had already taken subscription of Marrow, PrepLadder. Those were the two famous. And also everyone were attending DAMS classes. In fact, I also attended DAMS classes, the offline classes, but I went mainly because of peer pressure. But though the notes helped me pass my MB exams, my professional exams, but I did not study those notes in a way that it should be studied for cracking the Neet PG examination. So during my internship, during the end months, the end months of my internship, I suddenly realized that this getting into Neet PG is a very big thing. Actually, people are not going to respect you. At least in my surroundings, I did not see people who are called plain MBBS getting any kind of respect. I would not be able to handle that thing, that even after passing MBBS, the society is not respecting me. But it's not like that. I think I overthought a lot, because a doctor's skill is not evaluated based on the number of examinations they have cracked, but obviously based on their ability to diagnose a disease from the clues they get clinically or radiologically, pathologically, and then treat the patient in the best way, in the most cost effective way as possible. And that you can be that kind of doctor, you can be even if you are just an MBBS, but it does not work like that. People don't trust you if you're not an MD or MS, right? And surgical fields, so you cannot even touch most of the times if you're not an MS কি বলছি, এখন MD MS করলেও লোকে পাত্তা দেয় না, you have to do subspecialty. Okay, so in the last 2 months of my internship, I saw people had started studying, and I felt a little scared that time for the first time, because I had not studied anything and I had wasted my entire internship. But still, I told myself that now only 2-3 months are left. Even if I give my best now, because I don't have my basics strong, it will be very difficult for me, because the most important thing that you need to do in your preparation is make your base strong. And by base, I mean the non-clinical subjects: anatomy, physiology, biochemistry, pharmacology, microbiology, all these subjects. These are the bases, okay? Because many questions, they come in our entrance examination where apparently the question seems to be a clinical question, but the answer of the question is hidden somewhere in the non-clinical subjects. Okay, so I realized that my basics were not at all strong, because I told you I did not study as much during my first year, second year, okay? And now 2 months are left. Even if I give my best, I won't be able to get the best rank that I can in my career. So I thought ki chhaddo ji, jo chal raha hai chalne do. I continued the lifestyle that I was leading during my internship, that is doing work in the hospital, sleeping in the hostel, watching movies, going to restaurants. I continued, okay? Okay, I got the results, obviously, of these things, of ignoring my studies during my internship. Though I don't regret it, because I got to learn a lot of clinical stuff. I think I can save a person if he collapses in front of me. At least I can do the basic minimum that is needed. So my rank was 63,000. I did not feel any guilt initially. I was not sad initially. The reason is simply because I did not give my best. I did not study only because everyone was attempting the examination. That's why I attempted the examination. I did not prepare for it. But still, at the end of the day, I saw that my friends were very saddened by their results. Those who did not qualify, they were very much saddened by their results, and I was not. And that was the first time I felt ki no, now I have to study. That was the time I downloaded the coaching apps and all, because I saw majority were doing either Marrow or Prep Ladder. So I downloaded, I watched the free videos, and I wanted to see which video suited me. My initial plan was to stay back in Kolkata and do house staffship. I had even sat for the counseling of house staffship, and then I will do the TND classes of a certain offline coaching institute, and I will study. But then I went to 2 classes of that TND, and I realized that people there were already prepared. They knew all the answers. Even before the madam or the sir were asking the questions, they blurted out the answers loudly, and I felt so afraid of that thing. This was a teaching thing, right? And people were taking as an examination kind of thing, a testing kind of thing, and they were answering. In fact, 2 girls were sitting beside me, and I saw that they were literally fighting on who would give the answer first. And here I was sitting beside them. I did not even know from where the question was being asked. So that was the day I was totally triggered, to study well and clear up my basics. So that was the final thing that triggered me to study seriously now for the next years preparation, but I realized ki this way though it is not going to happen. I cannot continue in this TNT because here the people are already prepared, and the lectures that are being given, they did not touch the basics. They were being conducted in a way which benefited those who had already learned the chapter or the topics once, and not for people like us who were starting things for the first time. So then COVID also happened. COVID happened, and luckily our internships ended. I completed my internship on the 29th of February. It was also a leap year, on the 29th of February 2020. And I think by March, COVID had started. So the house staffship counseling for which I had applied, that got stopped, okay? And things were not proceeding. Then I had chats with few of my seniors. Out of them, one suggested I took up Marrow because it was very vast and inclusive of everything. So you do not have to search for other resources to complement the things that were given there. They teach the things that are required for your examination and even much more. So you will be fed with a lot of extra information also. So you need not feel any FOMO ki that person is getting to study more than me. No. And another senior, suddenly, he was not even very close to me. I suddenly met him during one of my last postings, and he said ki your first attempt should be your best attempt. It should not so happen that you are giving your first attempt next year and you are not able to give it wholeheartedly. If you take up house staffship, you won't be able to give 100%. That's the truth. You will be able to work, you will be able to get the money towards studies, you will be doing at least some percentage of injustice because you're not going to give your 100%. And if you not give your 100% in your first attempt, you will feel guilty your whole lifetime, because first attempt is the best attempt because you remember a lot of things you had studied during your UG days or the procedures you had done during your internship. So that was the thing that struck me. So that was a turning point in my life. I started thinking, do I really want to pursue this house staffship? Because no, I know this thing is not feasible for everyone. Everyone is not lucky like me to be able to leave everything, leave earning for one whole year and stay back at home doing nothing. Everyone cannot afford this. Though I did not have my own desk, chair, or a tab to study, at least I have a house to stay, and my parents and my sister with me who would take care of me and my mental health, and they would provide for me for one whole year, and they will not judge me, and things will go on more or less well even if I am not earning for 1 year. So I finally said my decision to my father. He was a little confused at first because I changed my decisions so fast. He probably thought I was very fickle-minded, but no, I had realized that yes, first attempt is going to be my best attempt, because this year I can allow myself to not earn and stay at home, but after this I have to earn, because though my family's financial condition was okay, but it was not very good also. I would feel guilty if I took more than 2 years. So that day I challenged myself that I have to score. But that time my aim was not to get any rank below 1000. I would have been happy if I got any clinical subject. And while doing my internship, I had got a little more interest on subjects like MS CNT, MS Ophthal, or MS General Surgery also. So I was a bit towards surgical field, because in the college where I was studying, that is Medical College, Kolkata, we got a lot of cases. There were lots of PGTs, PGT dadas and didis who would teach us a lot of things, and we got a lot involved in the clinical things. So therefore surgical fields attracted me when I started my preparation. But once I started my preparation, I slowly fell in love with the medicine subjects, all the MD subjects, mostly general medicine, then psychiatry. These subjects I totally fell in love with because it was like a detective game, right? So every medical scenario is a mystery, and you have to use whatever you know, whatever you have seen till now, to crack this mystery. And then every patient is a new mystery. And if you know the things well, if you know your theory well, you will be able to crack that mystery with the help of your other colleagues and all. So I so much wanted to take up medicine during my preparation period, but then we were preparing during COVID. I started studying every day 10 to 12 hours. I have even made a video about how I was studying. Then something happened, it was June. I still remember the date. It was 14 June. I was in the washroom and suddenly my sister shouted. My sister doesn't really shout like this. She has a very toned down behavior. She does not overreact. And whenever she overreacts on something, I become very afraid. So she overreacted, and in a hurry, I came out of the washroom to see whether everything is all right. Then I saw this news that Sushant Singh Rajput was dead, and that too by suicide, amidst all the depressive environment that COVID-19 was giving everyone. I don't know why I never get affected by film stars, movie stars, but I got affected a lot by his death. He was one of my favorite stars, and those days Instagram was not so popular. People did not used to post a lot in Instagram. I had not followed any film star back then, and the only film star I had followed was SSR, because he used to give posts regarding many other things other than movies, and I like that all-rounder thing about him. But when I saw this news, I heard this news, I was so heartbroken. It felt like a member of my family has died, and it was so drenching for me emotionally. I have a senior. She is from my hometown. She was my school senior. She was even my senior in UG college, MCK, and she was also my senior in MD Radio Diagnosis at NRS. She was one of the very few persons I used to talk with. Sometimes when I needed help, counseling, I talked with her. She said, no, everyone is devastated by this. Take 1 or 2 days off and then start studying. But the thing is, I tried. I could not, because these thoughts came into my mind that why am I sacrificing everything and studying only? I can earn, I can go here, go there, travel. I can eat at fancy restaurants. I can buy beautiful dresses. If I start working now, at least 50 to 60,000 salary I will get as an MBBS. So why I am spending all my time sacrificing my young age with studying? All those thoughts came in, and I could not study. And at the same time, all the news channels were busy making this death into a crime thriller. Initially I could not understand these certain interviews that they were conducting were actually fake, but with time I understood that they were making up a lot of things so that we get hooked. So as this is a vicious cycle, when you don't study, waste your time for a long time, for a long period, then because of the guilt again you don't study, and then you realize ki itna kam pada hai, if I start studying now, what is the use? There is no use, and then you again stop studying. So that's what happened with me. June, July, August, September, October, and then it was the November aims that were announced and applications were started. And then when I realized ki I had wasted a whole lot of time in this, and I made a promise to myself ki no, now I will start studying. Whatever 2-3 months I have left, I will start studying. One revision was done, only one revision was done, but I am that kind of person who is not able to remember. After one reading I will remember only 25%. After the first revision I will remember only 45%. So I need 3 to 4 revisions to remember at least 70%. Okay, one revision was done, so I thought of giving one more revision before the exam, but then the best news happened. I know it must not have been the best news for everyone, but for me it was certainly a very good news that the Neet PG exams got postponed to April. I got a lot of time and I started afresh. This time I had deleted all my social media accounts, WhatsApp, Facebook, Instagram also. However, I started an account in Instagram, which was essentially a studygram channel where I had given a fake name and I followed only the faculties, Neet PG faculties, so that I get to know any updates related to the exam. So that was a very good time. I was studying whatever I wanted to study. It was going on well. In fact, the last 2 days of the exam had also come. I think the exam was on 17th or 18th of April, and on 14th of April they had given the admit card, and the next day 15th April, which also happened to be Bengali New Year's Day. I went and printed the admit card. I had stuck my picture on it. I had signed it. So it was ready. My admit card was ready. And I was in the final 2 days of our preparation. We all were. And then suddenly on the evening, my friend called me up. He said, did you see Sumer Sethi sir has posted in Twitter that exam has got cancelled. I said, please don't mock with me. It must be a fake account. Then I opened Twitter. I saw Mansukh Mandviya ji has also posted, the health minister. And then there was no turning back from the truth. Neet PG got postponed the second time. And this time, though, I was at a loss because I had prepared. It was not the last time. This time I was prepared. It was such a traumatic period for me. It was the second wave of COVID going on. People were dying just like this. One day I see someone whom I know, he or she is well, and the 2 days after that, I learn a news that that person is dead. You can understand that you are studying, you are leaving everything else, everyone is in the home, no one is going outside. There is nothing, nowhere to go outside. April, scorching heat. People are dying. You are studying, you're giving your dash off to study. And then suddenly you get a notification that the exams are postponed and no tentative dates are also given. Nothing like postponed for 3 months, 4 months. No, just postponed until further notice. My first reaction was I cried out loud. I cried out loud. All my windows and doors are open of my room, and my neighbors, literally, I saw them come out of their houses because they could hear my scream. I screamed so loudly while I cried. I went up. My parents were very afraid. Ki, what has happened? I told them this. They asked me to calm down. That was Bengali New Year's Day, a day when Bengali mothers, they make delicious Bengali dishes. My mother had also made chili chicken and pulao. But I could not eat because, when you have an exam 2 days after, you cannot actually eat something or relish something, feel the taste. I was just gulping it down. We did not enjoy also. I did not buy new clothes also because I thought I will buy new clothes after my exams got completed because it was just 2 days afterwards. Then I cried alone and then I called up a friend and we cried together. So those were very emotionally tight days during my life. The next 1 month, I could not figure out what to do. So they were so depressing, and then my subscription, I had taken up Marrow and my subscription of Marrow was going to end. And they were charging some money for extension. And I did not even know till how many days am I going to extend it because we did not know the exam date. I had to extend it because if I do not keep doing the MCQs, do not keep watching the videos, I will forget things. Especially now when I had certain periods of disturbance in my studies, I needed the app so much more. It was, I think, 13,000 for Plan C. And I literally begged my father because it was a big deal. Even 10,000 rupees, spending 10,000 rupees all of a sudden is a big deal for my family. And I do not blame them. They had to spend on a lot of things. So it took a great deal of convincing my father. After 1 month, I realized why am I even crying? Why am I even feeling sad? I should feel happy because there were so many subjects that I had not studied in totality. Like in pathology, I had not studied the general pathology things very well. I had just brushed over it. I had not studied it in detail. In physiology also, the general physiology chapters, the muscle things, I had not studied very well. Then anesthesia was a subject that I had not studied well. In medicine, there were certain topics like cardiovascular, like rheumatology I had not studied very well. So there was so much syllabus, extra syllabus to complete. And I was crying. I was spending my time thinking, why did the exam get postponed? It was a very good luck to me that the exam got postponed because I got to study all those things. So again, I inculcated all those new topics in my syllabus, because the actual syllabus is something else and your syllabus is always something else, is always lesser than the actual syllabus. So I included those things in my syllabus also now. And I felt better because my GT scores started improving a lot, as in that those days before the second postponement, my GT scores were around 2000 or 3000. I was happy because even if I multiply it 2 times, I thought I would get a below 10,000 rank. But then drastically my rank started improving. I got 1000 rank in the initial GT after the postponement when I read all those extra things. And then on, it became 3 digit. And in the last 3 GTs, though, it was very good. 90, 46 and 42. So when I extrapolate this rank, I was sure that I will get somewhere below 1000. But this time, that this next stretch of preparation period, because I had increased my syllabus so much and I had a lot of expectations from myself. The initial 2 phases of study, I had not pressurized myself, because in the first time I gave Neet PG, I scored 63,000. So I knew that whatever exam I'm going to give this time, I'm at least going to get qualified to get the clinical subjects at least. But now when I included so many things in my syllabus and started getting a good rank in the GTs, I suddenly started to have these performance anxieties. I started to have this overthinking ki what if now my rank is coming out to be good and in the actual day of the exam my rank becomes very less. All these bad things started crawling into my mind. I also developed anxiety, though was there only. I also developed insomnia. I could not sleep. Even a little bit of noise in the room while I was sleeping would wake me up. No, I should have consulted a psychiatrist. Because it was COVID, at least online consultation I should have done. I did not do. But if you are facing, I suggest you to do it, because it is very terrible. Those feelings are very terrible. You are so much anxious. You are overthinking. The stress, till the time it's stress, it's very good. Once it becomes distress, it is intolerable. And from this stretch of study onwards, I started making my 20th notebook also, where I jotted down little things where I thought I would be needing in the last few days, because in the last few days I cannot study everything. In the last 10 days, I kept only selected topics, and in the last 2 days, I only read the topics that I had listed in my 20th notebook and also the sticky notes. I ate good food. I slept well also in the last 2 days, but just the night before the examination, I felt so much anxious, I could not sleep. In the normal days, 12 to 12:30, I would go to sleep. But that day, so that I get a good sleep, I went to sleep at 10:30. But still I could not sleep. And because I could not sleep, I became more anxious. Ki, what if I sleep during the exam? What if I'm unable to think because I'm not sleeping? My brain is not going to work the next day. In the entire night, I slept maybe for about 1.5 hours, deep sleep. I was lying down with my closed eyes, but I was never asleep. But the next day, exam went well. I had attempted the maximum number of questions that I would have attempted normally. I had left 8 questions and the rest I had marked something or the other. So never in my GTs I left 8 questions. I used to leave 12, 13, 14 like this. However, since the exam was not like the previous NEET, where in the previous NEET, the clinical based long scenario types questions were much more. Here in our exam, NEET PG 2021, the questions were more of one-liners. So that's the reason why I think the cutoff went such high, and my score was 638 and my rank was 702. So one thing I still regret a little that my exam could have been better was if I could get sleep the other night. But whatever it is, I got my dream branch. And how did my dream branch become radiology suddenly? When I bragged so much initially about taking up surgery and then about medicine, When the second time the exam got postponed, I saw a lot of YouTube videos because I got a lot of free time in the first 1 month when I was not studying at all. I watched travel videos and that excited me a lot. I know this might sound a little selfish. Then I actually thought this, why will I sacrifice my entire life for the well-being of others? During my duty hours, I will selflessly give my service to the well-being of the society for my patients. But when I'm not in my duty hours, I do not want to get disturbed at all. I do not want to get burdened by my work in my workplace, even when I am at home. I want to go to holidays, to vacations, and I do not want to have any burden on me when I am on those vacations. I do not want a lot of pleading to get holidays. So that time I realized that I think radiology will be the best thing that will suit the kind of lifestyle that I want now. But I do not want that lifestyle where I am in the ward 24 hours, 36 hours, 48 hours, and even for taking a meal, I need to ask permissions of my seniors, because taking a meal is the most basicest thing. Sleeping is the most basicest thing. I do not want that I am asking for permissions for doing the basicest things that is possible. And I want that in future, every branch becomes like this. Every branch becomes non-toxic. I don't know how much it is possible in India, because in India, we have so many patients, and less doctors. Okay, so that's the reason that even initially in internship, I was more inclined towards surgical fields. During my preparation, I wanted medicine, but just in the last 3-4 months, I had decided I will take radiology. So though I regret that I could not sleep the other night before the examination, but still it's okay, because I got my dream branch and I'm happy with it. And the last stretch was also very difficult, the last stretch of studies, because once in a while when I activated my Facebook or opened my WhatsApp or Instagram, I would see my colleagues, my friends, they are busy in an outing, they are celebrating, buying new clothes. Some of them were making reels on Instagram. Saw that everyone is having fun in their lives, and this is this normal human tendency that we become very frustrated when we see people enjoying, especially when our life is hell. And that happened with me also, but then I calmed myself down. I told myself ki this is for my own good. Do I want an enjoyment now and then stay with mediocrity throughout my entire life, or should I struggle now and then achieve my dreams and have a better life after that? So that's the thing that kept going. And there were few songs also which I played sometimes when my mood was off. One of them was the train song from Gully Boy, which was like, सीधे पत्ते परे बाजी तो जीत गया, पथ मुश्किल था मगर जैसे भी हो बीत गया, आज दुनिया भी तेरे साथ गुनगुनाती है, कल अकेला ही था जो दुख भरा वो गीत गया. And I wanted कि one day I am able to sing that song. And for being able to sing that song, I need to achieve what I wanted to do. And for achieving what I wanted to do, I need to work hard now. I know 702 rank is not a big deal overall. If you see, there are so many toppers who have ranked much in front of me. So compared to them, it's not a big deal. But for me, for someone who did not like medical initially, someone who fared very mediocre scores in their MBs, in their professional examinations, someone who had a rank of 63,000 in the first Neet, for her, for me, 702 though is good. I was satisfied. Yeah. I know the video was too long. Even if you get a little inspiration from my story, do like the video and subscribe to my channel. Bye-bye.